Good evening, everybody. Thank you so much for joining us tonight. If this is your first time, welcome to the program. And if you are returning, once again, thank you so much for your support. We appreciate it. Before we get started, I'd just like to read this brief disclaimer that you see on your screen. And the disclaimer is this: the PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now that we have that out of the way, I would like to thank you once again for joining us tonight. My name is Craig Orpello. I will be your host tonight. And what is this? What are you here for to see? Well, tonight you are here for the PharmAssist virtual learning experience. And it's an educational program created by Mandel's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your own home. As you can see, PharmAssist takes place every Monday night at 7 p.m. Eastern Standard Time. So congratulations, you're on time and you made it. Tonight, we'll be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A throughout the program. And how does the interactivity part work? Well, that's where you come in, and you're joining us either via Zoom or Facebook Live, whichever way you came. We invite you to be a part of the discussion by sharing your questions in either format, whether you are typing directly into the chat on Facebook or the chat and Q&A section of Zoom. Either one will work. We are as always, we are joined with various amazing HCPs each week from across the nation to provide you with a real world experience, just as if you were sitting across the table from them at the clinic. And today we are joined by Karen Hammond. So I want to thank you again for all your time and interest for joining us tonight. And I now would like to turn it over to Karen. Karen, take it away.
Hello, everyone, and thank you for joining me tonight, and Craig, and thanks to Mandel's for offering this incredible service that I think will really help lots of people just to feel comfortable with these medications. And you'll find out that you can do this, you can be a pro, and we're here with you every step of the way to get you through it. So as Craig said, I am Karen Hammond. I am a doctorally prepared women's health nurse practitioner in a private practice in Birmingham, Alabama. And I see patients just like yourself every day who are going through various fertility treatments and have been instructed to take medications. And tonight, I'm going to walk you through 3 of those medications: the gonolf multidose vial, the gonolf pen, and finally the Sonara Patch. And that's getting a lot of attention these days. So I'm excited to share this information with you. So the way this will work, as Craig said, I'll just go through a little introduction about each medication, show you a prepared video where I walk you through each and every step of doing it. And all along the way, I'm happy to answer any questions that you may have. All you need to do, if you're on Zoom or Facebook, you can just type in your questions, and Craig has graciously offered to go through these questions, share them with everybody else, and I'll be happy to do my best at answering them. There are a couple of other ways that you can get your questions answered. One is the most important, and that's discussed with your own healthcare provider. Your provider and the practice that you're seeing will always have the best information for you. They've tailored your treatment just for you and want to make sure everything goes perfectly. You can also speak with the folks at Mandel's. They're the ones who put together this great program, but they have also, they take care of people just like yourself every single day. And the only people that want you to be as pregnant as much as y'all do are the pharmacy and your provider, and of course me. So we want to walk you through every single step of it and make sure you're nice and comfortable. So as Craig cues up the first video, I'll give a little introduction to it. And it is the gonolf multidose vial. And it's one of my favorite ways to prescribe gonolf because it's a bit of a cost-saving method. Each 450 unit vial, it says that on the label, is actually overfilled and has 600 units. So sometimes that will make a big difference in stretching it along the way and giving you a little bit more medication than what the calculation of the cost actually is. So Craig, if you'll cue up the video, we'll go ahead and play that, and then I'll answer some questions for you on the other side of it. Hi, I'd like to talk with you a little bit about how to give the gonolf vial. It will come in a package that has a vial, 2 needles, and a syringe that has the saline to dissolve the powder that's in the vial. You start by just simply opening the package and removing the contents. Next, there's a little cap that covers the tip of the syringe. Just unscrew that to remove. Then you can put the needle directly onto the syringe. Your provider will tell you whether to use an intramuscular or subcutaneous needle. In general, this is given subcutaneously. Next, you'll take the top off of the needle and grab the vial that has the powder, the medication in there. Gently lift off the top of that vial. Put the needle directly into the rubber stopper on the vial and inject all of that liquid into the vial. Each vial has 75 units of gonolf in it. If you're prescribed more than that, you may need to use more than 1 vial. You'll still just need to use one syringe with the liquid. Next, turn the vial upside down and withdraw all the liquid by pulling back on the plunger. After you removed all the liquid, remove the needle from the rubber stopper of the vial, and you're ready to give the injection. Start by just wiping off the area that you've selected to do the injection. One time, put the needle straight in after you've bunched up the skin, slowly push in the medicine. Release the skin and pull the needle straight out. If there's a little drop of fluid or some blood on the outside, just simply wipe it with some alcohol and apply a bandage if necessary. Finally, take the syringe with the needle on it and drop it into a sharps container just to prevent any injury from it later on. And now you've given your first gonolf vial. So how easy was that? Actually, that video that we played was for a gonolf vial that's just 75 units in each vial. So there's a different one for the gonolf multidose. So if you have been prescribed the 75 international unit vial, that's exactly how it will be used. Sometimes you might be prescribed more than just 1 vial, more than 75 units. Generally, your prescriber will write for this dosage of medication where you get the 75 unit vials when you're on a very low dose, like 75 units or multiples of that. So in that case, if you need to use 2 of those, that's not a problem. If your dosage is 150, you still just draw up 1 cc. You just have that 1 cc of the liquid and you squirt it into the powder. Then you can draw that entire mixture up and squirt it into the next powder, and it's ready to give. So I'm going to pause right here and invite Craig to pop back on and tell me what questions you have.
All right, how's it going? Thank you very much. Now, so the first question that comes in, actually speaking of, like you were just about the idea of multiple shots or mixing things together, this question comes in saying, what do I do if I don't have enough in my vial for a full dose? Can I make it up tomorrow, or do I need to take 2 shots?
Great question. You should always do your very best to take the dose of medication that's prescribed for you. And your prescriber will tell you exactly how much that is. So if you don't have enough in 1 vial, then you do need to use another so you can get just that dose of medication. We prefer always that you take the dose that we've prescribed for you. instead of try to make it up in a different dosage or a different day, just because of how this medication is absorbed and released and how it works. So we recommend you try to do your very best to take it just the way that it's prescribed and take it on the days that are prescribed for you.
Perfect. Thank you very much. All right. Let's see. So another question coming in that says, what is the benefit of using gonolf alone versus Menopur or HCG as a quote unquote microdose? And then they snuck in a little side question that says, side question, what is micro or low dose HCG anyway? I thought that was supposed to be the trigger shot.
Great questions. So some patients will benefit from getting a little bit of LH. And I'll explain this a couple of ways. Gonolf and Follistim both contain one medication, and that one medication is follicle stimulating hormone, or FSH. One of the few hormones that our body makes that does exactly what it says it'll do, and it stimulates follicles to grow. It tells the ovaries to grow and develop the egg sacs to help the eggs get to be more and more mature. Occasionally, some women or women that are taking specific medications like Leuprolide, for example, need a little bit of LH too. And so sometimes that can be prescribed as Menopur, which is another injectable fertility medication where you take, it has a little bit of LH and FSH both in it. Again, Follistim and Gonolf are just FSH. Menopur is FSH and LH. Sometimes, usually for cost containment reasons, some providers may request that you take a little tiny bit of HCG. And the person asking the question is exactly right. HCG is normally what's used for the trigger shot. Sometimes a low dose of Lupron can be used for that. But occasionally your provider may recommend that you take teeny tiny little amounts of HCG. So instead of 10,000 units, you may be taking 200 units or even less of HCG. And your provider or Mandel's will help you know exactly how to mix that if that's been ordered for you. And LH, interestingly, mimics LH. And when you take LH in very small dosages, it will help to augment or facilitate the gonadotropin injections you're taking. When taken in bigger dosages, it actually is like a huge release of LH that does the final maturation and eventual release of your eggs. So sometimes FSH, like Gonolf or Gonolf or Follistim, can also be prescribed with this very low dose, microdose HCG in lieu of giving Menopur. Be sure to talk with your provider, talk with the folks at Mandel's if the microdose HCG has been prescribed, because we want to make sure that you mix it up just right. Great question.
Thank you too. That's a great answer for something that can be a little bit confusing to people. And I know part of this whole program is to try to get rid of some of those, any of the things that might be a little confusing or things that you're anticipating, any of the little things that might cause jitters. We want to get that out of the way right now so that you don't have to worry about it later. So awesome. Perfect answer. Thank you so much, Karen. And just another reminder again to everybody that you can type directly into the chat or the Q&A if you're joining us via Zoom, and directly just into the chat on Facebook, and we will get to everything. So speaking of, we have another question that came in, and that one is, I read that Serono offers a number of different financial discount programs for their multiple products, including Gonolf. What's the best way to find out about and or enroll in these programs?
Great question. And I am a coupon clipper, and I love to save money myself. And I love it even more, I think, when I can help patients save money, because these medications and the treatments can be so expensive. And most of us don't have that kind of disposable income to pay for these things. So when your insurance does not cover your medications, if you have been prescribed Gonolf or Cetrotide, there is a program called Compassionate Care that is income based to facilitate covering the cost of your medications. You can apply online for this, and it asks a series of questions. Again, it's income based, so it'll ask you some kind of personal financial questions, and then they get an answer back to you right away as to what percentage of the cost of the medications you can get discounted. So there are a few ways to find out about this. One is by asking your healthcare provider. I try to tell all of my patients that if they are paying cash for their medications, so they have no insurance coverage for it. That's one caveat that is required for to be able to apply and obtain compassionate care assistance. So no insurance coverage. Your healthcare provider should be able to give you a website to go online to retrieve that form. You can fill it out online. It just takes a few minutes. The folks at Mandel's are amazing. When you have your prescription sent in, they are awesome about asking you if you've applied for compassionate care and even help walk you through that, give you the web information and make sure you completely understand it. Or you can go online, you can just Google it. Google Serrano, that's the manufacturer of the medication, Serono. If I were Googling it, I just put in Serrano Compassionate Care, and it'll be really easy to find it. Another thing that you can do is if you or your partner are military, you can also get a military discount through Serrano. So that's very worthwhile to check out. Ask for these discounts because it's only gonna help you to do that. And the folks at Mandel's, like I said, are absolutely wonderful at helping to get that information to you.
Yeah, thank you very much for mentioning that too, because one of the key things we always like to say is we don't want it to feel like there is a secret knock that you have to know to ask for the program, and you have to know the password, and none of that. Our goal is to make sure that we get you access to any financial programs that we possibly can, anything that you're eligible for that makes sense. That we will make sure that we get you in and help you fill out the paperwork, figure out any questions that you may have. Our financial services team is there on your behalf because we want to make sure that you can take advantage of them. They're there, so we want to make sure that you can use them. So thank you so much, Karen, for mentioning that. And that was an awesome question. Thank you very much for bringing up that question. So let's see, now transitioning a little bit over from the financial side of it back into the actual injection medical side of it. And the question comes in saying, what can I do to prevent or treat the most common side effects associated with the gonolf injection?
Great question. You'll be happy to know that there are very few side effects with the injection itself. It's very easy to administer, as I showed you in the previous little video. You just kind of find a place where you can pinch an inch, put the needle straight in all the way, push in the medication. So it's very simple to do. Patients tell me every single day that this medication injection is not just simple and easy to do, but it's also fairly painless. I don't know that I've ever had anybody say that a gonolf injection was painful. So there aren't really any side effects with the injection itself. That being said, the process of stimulating your ovaries can be associated with some side effects. And generally that will occur after you've ovulated or after you've had an egg retrieval. For that, sometimes people will feel like some cramping, some kind of discomfort, some abdominal pain, bloating, where it just feels like your pants don't quite fasten up the way you'd like for them to. Occasionally people can have weight gain. It can be a significant weight gain, or can have nausea, vomiting, diarrhea. And in those cases, if you gain more than 5 pounds, if you are having nausea and vomiting, or anytime you have questions, you should also always reach out to your healthcare provider. The symptoms that I talked about are actually varying degrees of what's called ovarian hyperstimulation syndrome. And that is just a combination of these various symptoms that can range from very mild, which would kind of expect your ovaries to be somewhat stimulated and to have your ovaries stay a little bit big after you've taken these medications. But it can be bad. You can have some significant side effects from it. So If you have any symptoms, anytime you have discomfort, it feels like your ovaries are big or your pants are just way too tight. And certainly if you gain more than about 5 pounds, or if you have nausea, vomiting, diarrhea after you've taken the trigger shot, you need to be sure and reach out to your provider. There are some things that can be done to lessen the likelihood these things would happen, such as staying well hydrated. And you should not just drink water, but also things that have lots of electrolytes in it, like Gatorade, V8 juice, those kind of things, Pedialyte, any of the things that you like the taste of that also have some electrolytes in there. And you should always just talk with your healthcare provider and let them know. It's very rare, but occasionally patients have to be hospitalized because the fluid leaks from inside the cell to outside the cell, and that's what causes that swelling. So I don't want to alarm you about this. The incidence of being really sick from this is low. And the good thing is we can monitor you. Your providers can monitor you and see what your ovaries are doing, maybe what your blood tests are showing. And if it looks like it's dangerous for you to go ahead, or you do have a high risk, we can stop the cycle. We can cut back on your medications. We can withhold the HCG, or we can give you what's called a Lupron trigger, which is a small amount of Lupron that will, or leuprolide acetate it's called, that will kind of act a little bit like the LH surge, act like the LH surge, without making your ovaries work quite so hard and get bigger. So those are things, all things that you can talk with your provider about. Hope that wasn't too long and confusing of an answer.
That was great. Thank you. There was a lot to cover and a lot to unpack in that answer. And one of the things, this is actually probably the perfect time to bring up, as you mentioned earlier, not only are all these programs live for you to participate in right now, but you may even be watching this on demand, or you have the opportunity to go check it out on demand if you are here live. They're all available on our website. They're all available on our Facebook page and our Facebook page, YouTube page, and our Facebook page. And the benefit to that is, we don't want you to have to feel like, oh, you have to scribble down a ton of notes while these programs are happening live, that you're trying to get all the information, because there's a lot of great information there. You can always go back and watch the video on demand. You can watch this entire thing so you can hear Karen's full answer she just gave there. Or if you're just about to give your gonolf shot and you just want to watch that 2 or 3 minute video so you can be sure that you're doing things correctly, you can also do that as well. It's all broken out. So that was an excellent answer with a ton of information. And we definitely know that this might be something where you might jot down to yourself, hey, remember to go check out the on-demand version so you can get all of that and really be prepared. And that's really what this program is for, so that you can get prepared now so you don't have to think about it later when you're about to give that shot. So that's it. As of right now, it does look like we are all caught up with questions. So I will throw it back over to you, just Karen, to give people maybe another 30 seconds or so if they have that last minute question that they are trying to type in and they just haven't gotten it into us yet. But feel free, everyone, we will give you time. If you have questions later on about earlier products, we will certainly make time for that. The only thing I did want to throw out to you, just so you knew, is I may butcher this name, so I apologize, but I think it's Kaylin. Kaylin wrote to you and said, hi, Dr. Karen, and a big heart emoji. So,
oh, thank you.
So thank you very much for the shout out, Kaylin. We appreciate it. I apologize if I'm getting your name, if I'm pronouncing it wrong, but we appreciate you showing up to the program tonight. So over to you, Karen, as we give people some time if they do have any questions before we move on to product number 2.
Perfect. Thank you. So I think probably where we left it, I think the most important thing I can tell you is about ovarian hyperstimulation. I do not want to frighten you about that. It happens a little bit every time you take these medicines, but it's not particularly risky the vast majority of time. When your provider talks with you about taking these medications, we'll also talk with you about risk for ovarian hyperstimulation and things that you should watch out for. So don't be alarmed about that. Feel free to ask questions at this program, or definitely talk with your provider to make sure that you're comfortable with that, comfortable with the risk, and know what kind of things to look out for to make sure that you are taken really good care of. Any other questions, Craig?
There are no additional questions right now, but I did get a shout out that I nailed the name correctly. So I feel really good. So I'm
Perfect.
Quit while you're ahead. So with that being said, I am ready to get turn it over to you to get ready for product number 2.
Okay, perfect. And I believe product number 2 is the gonolf pen. This is probably the easiest of medications to talk to you about taking, because it comes in a preloaded, pre-filled syringe, and you simply just dial your dose, put on the needle, and give the medication. Nevertheless, giving an injection, especially if it's your first time, can be quite intimidating. Sometimes you'll want to do it yourself, and most of my patients do. Or you may want to have a friend or family member or your spouse give it to you. All of those things are perfectly fine. So, Craig, if you'll go ahead and cue up that video, we'll take a listen and a look, and then we'll answer some questions on the other side. I'd like to talk with you about how to administer gonolf using the RedEject pen. If your prescriber has prescribed the RedEject pen for you, it's very simple to give yourself the injection. When you take the pen out of the packaging, you simply remove the cap, and you'll see a dosing window on the side that tells exactly how much medication is actually in the pen. Next step in preparation is to take one of the needles, and it comes in a little package where you just pull off a tab, and then the needle will screw directly on to the tip of the pen device. Next, you'll dial your dosage, and for today's purposes, we'll say the dose is 150 units, and you just dial that. You see it in the window. No worries if you go beyond it. You can just dial the pen back the other direction, then take the top off of the needle. There's a big cap first, and then secondly, there's a tiny cap to cover just that tiny little needle. And to administer this, you give it subcutaneously. That means in the fat, generally in the abdomen or the outer part of the thigh. To do this, just choose your site first. If you want to give it in your abdomen, you should go someplace around your belly button, like where these little blue areas are, or either in the outer part of the thigh, anywhere really that you can pinch an inch. Then you pinch up the area because you want to make sure it's going into fat. You bunch it up a little bit, put the needle straight in all the way, and then depress the plunger. You'll feel it vibrate just a little bit as the medicine goes in. Then release the plunger, wait a couple seconds, and pull the needle straight out. And just like that, you've given the injection. After you've administered it, you want to carefully remove the cap remove the needle by putting the outer cap back on and untwisting it. Then you can dispose of it into a sharps container or protected device. Just drop it in there. If you look in the window after you're done, it'll tell how much medication you have left. And these pens are somewhat overfilled. So just because you've used what you think the total dosage is, take a look in that dosage window because you may have some extra that you can use. Then recap it, and you can place it back on the counter until you're ready for your next injection. Wow, how easy was that? That's just a really easy medication to administer. I'll tell you, as you start to type in your questions and Craig shares those with us, I want to just give you a little heads up about when you get your medication, the big box of medication that comes to you from Mendel's. Once you receive the medication, open up the box and make sure you have everything in there that you'll need. Sometimes there's maybe an oversight by your provider that they didn't include all the medications, and you don't want to be at the last minute and say, oh, I don't find this medicine in my box on 30 minutes before you're supposed to take it. There will be some medications that will say refrigerate upon arrival, that they will have a little sticker on the box that has that. They'll come in a little styrofoam container that has an ice pack or so in it, and you wonder what to do. People ask me all the time, do they really have to refrigerate it? And what about between injections? Does it need to be refrigerated? Well, the real answer is that these medications need to be used within 30 days after they're no longer refrigerated, or after they should be discarded after the expiration date. So I tell my patients that when they first get them, they can stick them in the fridge, take them out about 30 minutes, take out your pen about 30 minutes before you give the injection, just to let it come to room temperature. It'll be much more comfortable if you do that. And after you give the injection, you do not have to refrigerate it, because you're going to use that medication within 30 days. And if you don't, if it's been open for longer than 30 days, you should discard it. So once that has been punctured for the first time, you can't use it again. So I would just keep it out on the counter all the time after I give that first injection. Of course, out of the reach of any little hands or surprise visitors that you may not want to share that with, but just keep it out at room temperature. So Craig, let me turn it over to you and see what questions folks are having.
So this one came in actually during the video itself, and you just answered some of that right there, but there's kind of a part B to that question that I might as well, it's worth bringing up. So with regards to the gonolf pen, how do I store the pen between shots, which you just talked about, but how about if I'm traveling for work or for pleasure?
Great question. So if you're traveling, you want to keep it as close to like room temperature. 72 degrees, I think, is considered official room temperature. There's a range that's printed on the box of medication. Basically, you don't want it to get really hot or really cold. So if it were me, I'd probably just keep it in my purse. If I happen to be traveling, if you're traveling by air and you're going through TSA, what I'd recommend is that you put it back into the box that it came in, that has your name on it, and you put that in a separate baggie and put it through TSA security. It's going to have your name on it. It's medication. If they ask you about it, you can say, oh yeah, this is for my fertility stuff. And it wigs out the TSA people, and they're not going to probably ask you many more questions about it. I have never had a patient who had any issues going through TSA with medications. Just you've got your name showing it's a prescribed medication, and you'll do just fine with it. I have people that travel for a living or travel all the time for business or pleasure, and they just put it separately in a Ziploc bag through the TSA checkpoint. Other than that, just keep it kind of at a nice room temperature, not letting it have extremes of heat or cold. So I probably wouldn't recommend sticking it in the trunk, or definitely don't put it with checked luggage, not just because of temperature variations, but it's a little more likely if your luggage is lost, you don't want to be in a mess if you can't get your medicines.
Perfect. Thank you so much. That actually turned into a little bit of a travel pro tips there as well. Thank you so much, Karen, and thank you for that great question. I think hopefully people will be doing a lot more traveling hopefully soon. So these are great questions to know in advance as that starts to ramp back up again. Okay, so this is one that comes up quite often, and I think people are sometimes just trying to get ahead of it, and hopefully, like, if this happens, I just want to know how to deal with it. And maybe this person is hypothetically speaking about a friend of theirs, but it could be about a mistake that happened to them. But perfect place to bring it up. So what happens if I forget to give my shot of gonolf altogether? What do I do?
And people do forget that. We're only human. We can forget things during these COVID times. Sometimes, for me at least, it's hard to keep up with what day of the week it is. In fact, the medications I take on a daily basis, I finally had to break down and get a pill box just as a little reminder that has the days of the week to say, oh, did I take my medicine this morning? And I can look at the box and say, yes, it's empty. So don't fret too much over it if you forget to take it a day, but call your provider before you just take it right away. If you're an hour or even a few hours off, that's one thing. I'd say go ahead and take it, especially if it's gonolf, Menopur, or Follistim. I think it's fine to go ahead and take it if it's 3 or 4 or 5 or 6 hours off. The only one that's not so forgiving is the HCG. We've talked about that medication, the trigger shot, either HCG or Avidrel. That is really important. You take it at just the right time. but the other injections, the gonadotropins, are much more flexible. We don't want you to take 2 injections really close together without talking to your provider first to make sure that is in fact what you should be doing. Depending on your individual needs and your individual medication protocols and your health history, it may make a difference as to whether or not you should increase your dosage for the next day or skip that dosage altogether. So that's anytime's an appropriate time to answer a question, but that might be a time that if you realize that you've missed it, you might want to reach out through the answering service or call your provider's office, or however you can reach out to your doctor or nurse. You may want to do that even if it's after hours, just to make sure you do the right thing. Now, that being said, I had a patient this past weekend who was doing IVF. She was supposed to have a retrieval on Sunday morning early. So she was supposed to take her HCG on Friday. And for whatever reason, she didn't do it and realized it the next day when they looked at their written instructions, and then they should have taken it the night before. Fortunately, we were able just to schedule her retrieval a day later. She did great. We got a bunch of really nice eggs when we did her retrieval this morning. So oftentimes things can be fixed and adjusted. HCG is the most difficult one, either the HCG that you have to mix or the Avidrel. But the other injectables like the Follistim, gonolf, or Menopur, they're a little bit more forgiving if you should be late or miss one of those dosages. Just check with your healthcare provider first to make sure you're doing the right thing when you to see when you should take that dosage.
Yeah, and that's part of this program being, the part of the partnership between you as the patient, your clinic, the physician, the nurse, everybody involved there, and then obviously us on the pharmacy side, all working together. As Karen had mentioned earlier, there are going to be a lot of questions that we can answer during these programs, give you a pretty good definitive answer to feel comfortable about it as you get ready for that shot. And then there's going to be ones like this where it's a little bit more, we can guide you in the right direction. But to Karen's point, those are always going to be questions that are best served being brought up to your clinic, because they have specific ways they want to handle things, and that's great. And we want to make sure that, you stay within those parameters. But B, also, it's good for them to know and just to be aware when things like this happen, when it doesn't go exactly perfectly the way you hoped. Always best to reach out and just let the clinic know. So this is a perfect opportunity just to remind you again, we're always here for any questions we can answer, but also to remind you that that's a phone call you can always make and get a really good answer from your clinic as well. So thank you so much, Karen, for touching on both of those parts of that question.
Sure.
Hopefully we reminded people, just maybe set an alarm or set a little ping on your phone or one of your multiple intelligent AI speakers that you might have around your house that hear me constantly every time I speak. So you want to make sure that you have different options there to remind yourself not to miss it. And then you don't even have to worry about the question. So sounds great. With that, let's move on to the next question. So we have one that's more, I guess, somebody just trying to get an idea of how the product's going to work and kind of what the cycle is going to be like. So for a new person, interesting question to ask is, so how long will I be on, or how many injections of gonolf will I typically take by the time I complete my cycle?
Great question. And it's like so many of the things in fertility, everything is very individualized. So your provider may be able to give you an average number of days you'll take the medication. And we try to be really good guessers, and we're pretty good at it, knowing how much medication to send to the pharmacy for you, so you don't have a lot left over or have more expenses put out than you would hope for by having those extra medications. Nevertheless, we don't want you to run out of medications either. So your providers are going to be really good at trying to figure out the right amount of medication to send in for you. So I would just say, ask your provider what they expect. Sometimes in a first cycle, we can make a guess, but we may not really know. In fact, the reason you're monitored every cycle you take this medication is because even the same person can be different in different cycles. So ask your provider what they think will happen. we will be guided by doing ultrasounds and maybe blood tests to see how much more medication you need to take and if the dosage needs to be adjusted up or down. Your providers are going to have great experience that they can share with you to give you a little bit better insight than I can or any of us can through the concept of a video that's really generalized. Craig?
Yeah, and perfect, because everybody is so different. I think it's something that people take a little bit of time to get accustomed to and get used to, that idea that it's not just like, oh, we flip to the, the playbook and it says, this is exactly what you're going to do. And here's what you're going to take. And this is how the process is going to work. That's not the case, even from one person from cycle to next. So it's really great to be able to ask those questions now, just so you feel comfortable and know that the decisions that are being made specifically for you and your needs, and the way your body's going to result and react to it. And a lot of times the process might change even during the process, because you react to how your body is reacting. So great question, great answer. And I do have a question here that says, okay, it's comes with a little bit of a setup. It says, just so you know, I'm really not a big fan of shots. So that's kind of the setup. With that being said, what's the best way to handle a situation where I know I don't have enough medication left in my pen for my full shot before I give it?
Great question. Nobody really is a fan of shots. Nobody I see anyway is. And I'm not either, to be honest with you. So if you don't think you're going to have enough medication in there, well, first, once you take one of these injections, you're going to realize it's not nearly as bad as you thought about it being. It is a very simple, very short, tiny little needle. It's just, it's a half an inch. So it just barely has to go in. And most people don't even feel this medication. So after you've done it a time or two, you're going to realize that it's pretty easy. If you're taking one of these pens and you have a little bit, if you have some left in there, if it's not enough for the full dose, you will need to take another injection from a new pen. The other thing that you can do, and I'm far too frugal to do this, but the other thing that you can do is just start a brand new pen and dial the dose. One of the cool things about the gonolf multidose pen is that in that little dosage window, it tells you exactly how much you have. When you first look at it, it's going to be more than the amount that is on the box as to what's in there. So if you really, really, really don't want to do 2 injections, the only alternative you're going to have is going to be to start a new pen. Sometimes if you're taking some other medications too, it can be finessed a little bit, so you won't have to do that. But I will defer to your healthcare provider to know exactly about that. Depends on what medicine it is, if you can mix things to do in one injection.
Perfect. Yeah, and sometimes I think one of the best things we can do here is just level set expectations. So to let you know that sometimes it might require, or the best bet is still to use that second shot, but a lot of it is the only really difficult one is the first shot, because it's the one that you're not expecting how it's going to play out,
right.
You know what it's going to feel like and all that. After that, you'll see how easy it is. So it's great to get those questions out of the way now, so that you can go in as a pro and get that first shot over with and ready to move on and get to the next step. So perfect. We are, it looks like, caught up on questions right now. We will give, as always, we'll give another 30 seconds or so just for people to get those last questions in before we move on to the third and final product. But I do, before I kick it over to you, I just wanted to let you know a couple of messages that did come in on Facebook. So Casey said, "Hey, Dr. Karen, your sweet IVF baby, Nora, is watching you and smiling." So,
oh, wow. Thank you.
Excellent. That was all. Thank you so much for sharing that, Casey. That's the best. I'm sure, Karen, that's probably your favorite part of it, right? Is that?
Oh, love it.
That's the amazing part. I mean, that's why everyone's in it, is for those moments, and we love to hear that. So anybody that can share those little thank yous are always much appreciated. Not just us, but certainly for Dr. Hammond. But another one, then there was a couple of just a bunch of hearts that popped up in there from, again, I'm being tested on the names, but I believe it might be Lakin. And it's just a bunch of hearts, just letting you know that there's a lot of love in the Facebook for you. So I just
thank you.
You knew what was going on, but we will give people another 20 seconds or so to get that question in if they have one before we move on. Back over to you.
Perfect. Thank you so much, Craig, and thanks to you ladies for being with me tonight and for trusting your care to me. I love you guys and only want the best for you. Just to kind of summarize a little bit about what we've talked about, these medications, the gonolf pen, it is so easy to do. I don't think you should be nervous about doing it at all. This video might be really helpful for you if you've never taken the medication and you just want a little refresher. Your provider may have already talked to you about it, but take a look at mymandels.com/PharmAssist, and you can find my videos as well as some other providers. You can take a look and it'll be like a Jane Fonda workout where you just follow along as we do it, and we can do it together. Your dosage just may be a little bit different, and you can see exactly how it's done and make it really easy for you so you too can be a pro at it like some of these ladies. And little Nora's mama is a pro at this. So ask your friends, talk to the people in the waiting room, but first and foremost, talk to your provider and talk with the folks at Mandel's. So any other questions, Craig, before we go to the last product?
The only other thing is just one more little shout out for you. We got a from Christiana. It says McConnell and Mommy are watching Karen, and you got a bunch more hearts in that one as well. So everybody's showing up to say thank you, and
thank you, Anna.
That's excellent. So thank you for sharing that. Anyone else, feel free. We love to hear that. But seems to be all caught up on the questions, so I'll throw it back over to you to get started on our third and final product of the evening.
Okay, perfect. So all you folks out there that are worried about taking an injection and worrying about it being painful, probably the one that you've worried about it most is progesterone in oil. And we now have this really cool product called a Sonara Patch. And it looks like a big Band-Aid, and you just apply it to the area where the intramuscular injection is going to go. About 20 or 30 minutes before you do that injection, and it actually kind of numbs and warms the area that the injection will be administered, and it makes that injection painless. So, Craig, if you'll go ahead and cue up the video, and then we'll answer some questions that folks may have after we show it. I'd like to talk to you about applying the Sonara Patch. This patch may have been prescribed to you, or at least offered to you by your healthcare provider just prior to giving your injections. If you particularly have a fear of needles, or if you're worried about one of the injections hurting, this patch may be a good alternative for you. To do this, you first want to take the patch out of the package just by opening it up. And it looks just like this, kind of like a big bandage. And there's a little opening right here where you can pull the patch off of the outer backing and apply it directly to the area, the sticky side, directly to the area where you're going to give the injection, and it'll just stick to the skin. In most cases, it's for progesterone, and you're just going to apply this directly to your hip. This part right here is medicated, and it will feel warm to the touch, and it numbs the skin down deep so that the injection will be fairly painless. It's important that you apply the patch about 30 minutes before you take the injection. When you're ready for your injection, you simply remove the patch, wipe the area with alcohol, and administer the injection. You may continue to feel a little bit of warmness or a little bit of numbness for up to an hour later. Perfect. So some of you may not be familiar with this medication, and we have recently, within the last 6 months, started offering it to our patients, and they really love it. The medications, it comes in individually wrapped little Band-Aid looking things, or big Band-Aids. They're this big, and just goes right over the area where near where you're going to take the progesterone injections. They do cost about $10 a piece. So on the prescriptions that I write, and maybe your provider as well, it'll say you can have those upon request. It is a prescription medication. So I'll write Sonara Patch on request, just because we don't want you to get a bill if your insurance isn't covering it. Some people say they don't care if it costs $50 a patch. They're worried about taking those progesterone injections and they want to get the medication. So that is an optional medication that you can order at your own discretion. Craig, what questions do we have?
Perfect. So one comes in just saying, so is it correct that it is one patch per day?
That is correct. This medication, I've had people try it to cut it in half, but don't cut it in half. That does not work. That's a bad failure. So don't waste one by cutting it in half. But it is one patch before each injection that you take. Now, if you've been prescribed 2 intramuscular injections to take on the same day, and some of my patients take both intramuscular estrogen and intramuscular progesterone, you can do 2 on a patch that way, but you can't pick the patch up and move it to another site or put it back on the backing and use it another day. So it is 1 patch per day for the injections that you need for that day. And I also only recommend it for people that are taking intramuscular injections, just because the sub-Q injections are so easy and so much less intimidating that I don't think you need that for the sub-Q injections at all. Great question.
Perfect. And then this question, I guess more just about the how to use it correctly, about the not covering the patch, that part of it. The question says, how loose must my clothes covering the patch be to ensure that it works correctly?
You know, any clothes that you're normally wearing, you don't want to put, if you think you might want to put an ace bandage around the area, just have something really, really tight. Maybe it'll go in deeper or further or work better. I tell patients just to wear whatever they were to work that day. You just don't want to wear something that really compresses it. And again, you just put it on 20 or 30 minutes before your injection. Craig?
Yep. And yeah, I think part of the covering it, don't cover it could be a little confusing to people, because what does that mean? And it's good to always clarify that it's not just like, oh, you have to leave the area completely open. It's just that any regular loose clothing, normal clothing is fine. You just don't want to wrap it up. So thank you for clarifying that. That's great. Okay. So if I'm not sure if I'm going to need one, is it possible to put the patch on after the shot if it hurts more than expected in a specific injection site, or is it only for beforehand?
You know, I'd recommend you only use it prior to the injection. If you watch some of the videos that we've done on administration of progesterone in oil, that can really be done fairly painlessly too. So people that have discomfort after progesterone, it's generally not immediately after or a few hours later. It's after they've taken several injections of progesterone that there can be some issues. So I'd recommend that you only use it prior to doing the injections. But that's a great question. Great thought.
Cool. All right. And then we have a question just about safety with the product. And it says, is it dangerous if I forget to take it off after about the 30 minutes or so? I just don't want to be in a situation where I overdose or anything like that.
Yeah, great question. And I worry about medications, taking medications and making sure I'm doing them right too. I don't think you need to worry about overdosing on it, but it's going to have its maximum efficiency after about half an hour. So it's a big Band-Aid looking thing. You're not going to forget to take it off. I do recommend you take it off when you're going to take it off right before you give the injection, so you don't have to worry about it, forgetting about it, because you're not going to forget your injection. So after you take it off, don't be tempted to put it back on. It's really not going to do anything else. And I'm not worried about you overdosing.
Perfect. Thank you again. I know people sometimes want to get that stuff out of the way now. You don't have to worry about it later, but definitely safe. And this one's pretty easy. So it's not too hard for most people to, get the process of how you use Sonara. So we don't have a ton of questions. So it looks like we are, this just popped in as I asked. So a question comes in saying, are there any side effects that I should know about? Headaches, long lasting numbness, etc.
Yeah, a great question. And there aren't. It'll stay numb, for maybe another half hour or so after you give the injection. But hey, that's okay too. It's done what it needed to do. And the person that wrote in that question worrying about it, wanting to put it back on, that just shows that you're not even going to need it. It's going to stay numb for a little bit longer. It's not going to be like when you go to the dentist and have a shot in your mouth and it stays numb for hours and hours. It does go away fairly quickly.
All right. And I think with that being said, it looks like that's the last question coming in. So as usual, we'll open it up for another 30 seconds or so. Now, feel free if you have questions about any of the three products we talked about today or anything tangentially related to them. That's what we're here for. So feel free to ask those questions. But in the meantime, while we give the people some time at home, I will throw it back over to you, Karen, if there's anything that you want to share with the group as we start getting ready to wrap up the program.
Perfect. Okay, so I'm going to tell you a well-kept secret that I don't tell just everybody, but since you were so kind to join with us tonight, I'm going to share this with you. Some women and men too absolutely hate having their blood drawn, and they worry about that needle stick or their veins are hard to find. Ask your provider, would it be okay to put on a Sonara patch? Now, this will have to be something that's sent to you that you have. The offices aren't going to have them, but you can use a Sonara patch where your very favorite, biggest, best vein is, and just put that on your arm about 20 or 30 minutes before you have your blood drawn. And it's not going to interfere with your blood test, but it'll numb up that area and make it warm, and that'll make your vein pop up a little bit better and make your blood draw easier. So that's a nice little pearl if you really, really hate to have your blood drawn, and it's worth $10 for you to not be able to feel that. So thought there. I love these Sonara patches. I think patients really appreciate them, especially folks that have to take progesterone for a long time. In my program, I have people continue their progesterone until they're about 6 or 7 or 8 weeks pregnant, if it's with a fresh cycle. But if they are doing a frozen transfer, then or an unstimulated cycle, they might need to take it for even as long as 12 weeks. So the progesterone patches can really be good for that. So keep that in the back of your mind. Any other questions come in, Craig?
It looks like we are all caught up. So I think you got to everything. You answered all the questions that came up, and everyone feels pretty comfortable right now. And they're probably especially comfortable knowing they can watch this again later. If they have any questions, they can go back through and say, oh, I missed this part. So you did a great job, Karen. You covered everything. So I think we are just about ready to begin to wrap up the program for tonight.
Perfect. Well, thank you so much for joining us tonight. This program, I think, has been very valuable for so many patients, just to have a little refresher. Sometimes you go in and see your provider and you've got so many questions and so much information coming in at all different directions. And then you open up the box and see all that stuff in there. It can still be intimidating. So take advantage of these programs. They're free. They're easy to access. Just go to mymandelspharmacy.com/PharmAssist. And you can take a look at previous videos I've done, as well as other healthcare providers, just to make sure that you are very comfortable with the way you're doing it, and you'll feel like a pro before you even do that first injection or use the first patch. So feel free to always ask your healthcare providers, take a look at these sites, or ask one of our friends at Mandel's Pharmacy. We all have your best interest at heart and want this to be as easy for you as it can possibly be. This is a program that we do every Monday night. There are different providers on various days, but every Monday night you can tune in to this nice presentation that we all put together to get other opinions about doing the medications and learn about all the different medications that we prescribe. So, Craig, if there are no more questions, I'll turn it back to you as I thank everybody for joining us tonight and wish you an awesome week and lots of success with your treatment.
Perfect. Thank you so much, Karen. And obviously, as always, I want to thank you so much, Karen, for your time and your expertise tonight. As you always bring some great stories and some your knowledge, obviously, but to being able to give some of those pro tips, I think are some of the stuff that people really, really can benefit from. So thank you so much for everything tonight. We appreciate it. And of course, I want to thank everyone at home, whether you joined us from Zoom or Facebook Live, for sharing those excellent questions, some of those great stories about successes that you've already had, because it's always fun to have people, be able to hear from the people that have been there before, to know that you're not alone in this. And so we hope that everybody was able to learn something. And even if that was just to give you a little bit of a extra kick of positivity that this is going to go well and it's not going to be as hard as you may have thought, we hope that we were able to bring that to you. As always, and just to reiterate what Karen said, because we know that hearing it once is great and twice is going to help you remember even more. All of these virtual learning experiences, or VLEs, as well as the individual product demonstrations, they're all available at all of our different sites to watch on demand. So you can find that on our YouTube page, the Facebook page, and as Karen mentioned, our mymandelspharmacy.com/PharmAssist. These videos are there, but also you'll find some other projects that we're working on, some other educational talks, some conversations with some of our nurses about why they got involved in IVF. So just some other things that can really help to motivate you throughout this process and keep you focused on the end game in mind, and really the process that you're about to go through. So we look forward to seeing everybody here again next Monday night at 7 p.m. for an excellent program, Eastern Standard Time. We will have another great speaker to be able to go through some of these different topics. And we really, really, really have to ask you, more than we can ask anything else, is if you thought this program was valuable, if you learned anything from this, whether you're watching it live or you're watching on demand, please share this with anyone that you think can benefit from it, whether that is a family member, a friend, a colleague, somebody you bump into at Target that just seems like maybe they want to know all about the PharmAssist program. Please just let them know. It's the best way to get this information out there and for people to find out about it. There's somebody definitely else out there just like you who's looking for information, and you can be that conduit to help them out. So we really appreciate that. And with all that being said, thank you so much to everybody. Thank you again, Karen. Thank you, everybody at home. Thank you, everybody back at Mandel's helping to put this program together, and have an excellent night. We will see you next Monday on the PharmAssist program.